Continue digging into the 2023 guideline. In this part, I want to talk about pharmacological supplements and medications for treating chronic venous disease. Venoactive extracts, also known as flavotropic or flavonoids, are prescribed more in Europe than US. Actually, no medicine will cure varicose veins, although some may benefit venous edema and ulceration. Venoactive drugs, as you can see in this table, are flavonoids, saponins, and other products. Flavonoids include 1-diosmin, 2 micronized purified flavonoid fraction or MPFF, and 3 rhodosides. Saponins include horse chestnut seed extract and roscus extract. The last category is calcium dobesilate as a synthetic product. Some other plant extracts are also introduced. Although mechanism of action in these venoactive medicines has not been well known despite numerous studies, they are all associated with better microcirculation. It is providing by improving venous tone and decreasing capillary permeability. Varicose veins are associated with a wide range of symptoms. In patients classified as having stages C0S to C2S, for whom invasive therapy is not a plan, flavotropic drugs appear to be a good first-line treatment. At more advanced disease stages, flavotropic drugs have no demonstrable additional benefit over compression on improvement of skin changes or in ulcer healing. One exception is for MPFF, which may be used in conjugation with sclerotherapy surgery or compression therapy as an alternative treatment when surgery is not feasible. Let's review the most available products in the market. From flavonoids, micronized purified flavonoid fraction or MPFF is a combination of 90% diosmin plus 10% hesperidin. Literature review showed that since 2018, the role of MPFF in patients with all stages of chronic venous disease are highlighting. It has been shown to protect the microcirculation from damages secondary to raised ambulatory venous pressure. It decreases the interaction between leukocytes and endothelial cells. Its usage for therapeutic purpose in patients with C0 and C1 who have temporary venous reflux and patients with venous ulcer and post-thrombotic syndromes is proved. However, diosmin is not recommended for use in children, pregnant women, or women who are breastfeeding. MPFF is strongly recommended to treat pain, heaviness, swelling, functional discomfort, cramp, leg redness, skin changes, swelling, and quality of life, and weekly recommended for paresthesia and burning sensation. Through another systematic review of literature, it has been reported that the use of MPFF together with varicose vein surgery or sclerotherapy helps to improve VCSS. Another flavonoid, rhodoside or oxyrotins, has strong recommendation for treatment of pain, heaviness, and cramp, and weak recommendation for edema. 3. Among sapiens, roscus extract, a product which is combination of roscus extract plus hesperidin plus vitamin C, and the name is cyclo 3/4, is strongly recommended for treating pain, heaviness, swelling, leg fatigue, paresthesia, and edema, and weak recommendation for cramp and itching. Sapiens such as horse chestnut seed extract. For sapiens, there is strong recommendation for treating pain, itching, and swelling. Synthetic products such as calcium dobesilate. There is weekly recommendation for these products to reduce cramp and restless leg. One side effect, which is agranulocytosis, limit its widely use. The skin irritation caused by chronic venous disease called stasis dermatitis often improved by using moisturizers. Sometimes a steroid cream or ointment is needed to help with itching and inflammation. Although not generally classified as venoactive drugs, pentoxifylline was reviewed previously and showed that it can be an effective adjuvant to compression therapy to treat venous ulcers. Generally, it is usually not recommended to combine multiple venoactive drugs in the same prescription. Therefore, it is necessary to select appropriate venoactive drug according to each symptoms. The period of use for venoactive drugs seems to differ depending on the clinical situation. According to previous reports, these products have been used 2 weeks before surgery and 4 weeks afterwards in some studies. In the earliest stage of CVD with C0 to C2, it was used for 2 to 3 months, while in advanced disease with C3 to C6, it was used for 3 to 6 months, and in case of post-thrombotic syndrome, it was used over a 2-year period. It is mentioned that the full effect starts after 4 weeks. Subsequently, in patients who shown an effect, you may assist to stop the drug after more than 6 months of use because changes in the intestinal microbiome have been noted while taken for a long time. Moreover, regarding new guideline, MPFF or Varicose extract has shown superior effectiveness in real-world population compared with other venoactive drugs.